Peter, thank you very much indeed. And ladies and gentlemen, I can't tell you what a pleasure it is to be here. I was told that I was coming to a medal presentation ceremony, and I assumed that we'd be running this in the way that the Oscars and the British Arts Awards, and so I came dressed for the occasion. What happened to all of you? That's what I want to know. But forgive me, as Peter said, I'm on my way. Today's a big day for the university. It's our annual celebration of big donors to the university. And so it's called the Chancellor's Court of Benefactors. It's happening, and it's where I have to rush off to. But I mentioned Hollywood and awards given in Hollywood, and of course that's for fantasy. We're giving awards today, very special awards, for reality and for the way in which all of you, when the needs arose, got deeply involved in tackling the real world of infection and the real world of disease. And so I'm thrilled to be here to recognize all of you and the roles that you've played. Now you, this audience, don't need me to tell you how critical and how important a fast reaction to the Ebola outbreak was. It began in West Africa in March of 2014, and now 28,000 cases and 11,000 deaths later, it's 10 times bigger than all of the other outbreaks of Ebola that had occurred. And I think all of you recognize that the reaction around the world was slow. The reaction did not sufficiently recognize the immediacy, the challenge of the outbreak, all with the one exception of Médecins Sans Frontières, which very much got involved early on. And I'm proud to say that Oxford too, the University of Oxford and the different teams throughout the University of Oxford were among the first to respond to the call for research, respond to the call for identifying ways in which treatment could be offered, in which the outbreak could be slowed, and the development of vaccines and the development and the testing of experimental drugs by the teams from Oxford was absolutely critical and remains critical for the management and the tackling of the disease. Now, it seems that the time has gone so fast that crisis was on the front pages of every newspaper. It's funny, isn't it, in the world how crises change, and now we have another one on the front page of every newspaper. But that shouldn't prevent us from remembering that these kinds of outbreaks, these kinds of massive infections can arise at any time, essentially anywhere, and we need to be ready to respond. And all of you know that a year ago today, the 19th of September 2014, Peter and the team received a £3.2 million grant from the Wellcome Trust to go out and test the experimental new drugs for Ebola. And again, this was a wonderful demonstration, a perfect opportunity to show the structure and the commitment of scientists and clinicians in Oxford and their deep engagement in global health and tackling the key issues. I know for all of you who've been involved, who've been out in the field, this hasn't been an easy journey. It hasn't been a straightforward series of steps. The clinical trials during the Ebola epidemic forced you out, many of you out into the field to tackle really quite searing examples of human difficulty, human misery, human challenge. But you responded magnificently, and it's that we're recognizing and congratulating today. You've all, whether in Oxford or whether in West Africa, played a key role in this achievement, in running the clinical studies here in Oxford, as well as the clinical staff based in West Africa, and the volunteers from all over the world who gave up their time, who gave commitment, and perhaps well, not perhaps, definitely, most significantly, put their personal safety at risk to be on the ground, to be with the patients, to be with those suffering from the epidemic. And I'm really, as I said at the beginning, delighted to be here to personally thank all of you on a gorgeous late summer's evening in Oxford, Exeter College. The sky, as it always is in Oxford, is bright blue, as all of you know. And it's great for me to be able to award medals. And these are the UK government Ebola medals for UK citizens who volunteered in West Africa, and also the University of Oxford Ebola medals, which have been specially commissioned to recognize the bravery and the hard work that all of you put in to this incredibly important challenge, and that have helped us, very significantly helped us, to overcome Ebola and to put it behind us, at least for the time being. Now, unfortunately, a number of colleagues from West Africa were unable to be here today. So before handing out medals, I would like to personally thank a number of them. I'd like to thank Colonel Fode Sarr, the principal investigator in Sierra Leone, and his staff, Regina Gandhi, Sebatu Joseph, and Hassan Osman, for their contributions to this great endeavor. And so would you join me in a round of applause for those who cannot be here? But many of you are here, and so we will be able to recognize and to thank you with the award of these medals. And so I'm going to hand over to Tatiana Verden in a few moments, who will call out the names of those receiving medals. I will hand the first few, and then I'll hand over to my distinguished colleague, Professor Peter Ratcliffe, who will then hand some of the later ones over. But again, this is a wonderful opportunity for us to do something I think we don't do often enough in this world, and especially in Oxford, and that's to say thank you. Thank you to all of you for really an incredible commitment and, quite frankly, an incredible achievement in all of the work that you did in fighting Ebola. So let me now hand over to Tatiana.
Dr. Mohammed Samai. Dr. Stephen Kennedy. Dr. Baimba Idris. Dr. Thomas Mathakwai.
This is a man properly dressed.
Dr. Peter Horby. Alistair Bolt. Anne Saunderson. Ben Hope Gill. Claire Simpson. Georgina Simpson. Jillian Courtauld. Heidi Dawson. Jake Dunning. Jamie Murphy. Maria Moore. Sister Maria Chidi Nujuku. Matt Jackson. So Matt will be accepting at dinner time. Paula Melrose. Pete Scott. Rebecca Inglis. Steve McSwiggan. Sumaya Kazuji. Sue Ferguson. Tom Rowlandson. And Victoria James.
Let me now hand over to Professor Peter Ratcliffe.
Just to be clear, the Vice-Chancellor has asked me to say that receiving a medal from myself rather than himself is of no differential importance. We're proud of you all.
Annick Anterien. John Whitehead. Mary Van Lieshout. Piero Oliario. Katrin Moore. Tatiana Verdon. Edward Gibbs. Jennifer Groves. Julia Garcia Gonzalez. Jeffrey Carey. Amanda Mariana Rojek. Raúl Pardina Solís. Catalina Perez Landa. Karen Mandelsweig. Ashling O'Neill. Annalise Gillison. Mauricio Beller Ferri. Christophe Longuet. Gail Carson. Lindsay Castle. Emmanuel Denis. Sarah Moore. Becky Howell Jones. Kasia Stepaniewska. For dinner. Indeed. Laura Merson.
Well, as I said, we're proud of you. And in closing, I'd like to echo the Vice-Chancellor's words. with one slight extension, if I may. We're not, I guess, entirely sure that things are over, but let's say this success is an enormous credit. The control of a fearsome epidemic of this type, you should all be rightly proud of your contribution to that. But I think there is one other thing to say. As the Vice-Chancellor pointed out, the response was delayed. And I think more than anything else, that unfortunate situation demonstrates with total clarity just what will happen if the international community makes no response, and what can happen if it does. And hopefully, not only is this a success story in terms of Ebola, it is a success story for all time in demonstrating what the international community could and should do when faced with this type of event. And I hope that you all feel justifiably proud of your contribution to what I think will be a transformative event. I'm proud on part of the Oxford University, the Department of Medicine, of all the staff associated with this university, and colleagues in West Africa who all, I think, pulled together in what was a tremendous demonstration of personal commitment, time, bravery to bring us together on this happy occasion on a glorious day in Oxford. So thank you all very much indeed.
One final presentation from Peter Ratcliffe for Professor Trudy Lang, who we missed out because we thought she wasn't going to be here, but she squeezed us in. So here you go, Trudy.
I'd just like to point out that was not my mistake. We do meet occasionally in the pub on Friday evenings, but it's not an intention to save the ceremony for that. Well done.
You got your special own ceremony there, Trudy. Okay, and there's also some additional staff who were essential in the very difficult part of writing the all the contracts and things like that. So Carly Banner, where's Carly? Here's Carly. So this is for Carly for services to contracting. And also Graham. Where's Graham? Graham. Services to legal troubles and overcoming them all. Thank you. Okay, great. And Louise Siegfried? Where's Louise? Louise, another essential pair of hands in the department. Well done. Thank you. Last but not least, organising this event's been a huge, task for many people, particularly getting, everything organised, but also the medals and the ceremonies and all these things in time. So a special hand for Tatiana Verdon, who has been fabulous. And also to Catherine, who has done a fabulous job as well, helping Tatiana with organising everything. Thank you very much. Okay, so thank you everyone. You can go back to your champagne dinners at what time, Catherine? You can tell I have nothing to do with this organisation. So 6:30. So drinks here till 6:30 to 7. Thank you.
And four bottles remaining, Peter. But just one final thank you. He's already received a medal, but further thanks undoubtedly due to Peter for his dedication to this cause and his contribution for the event today. It's fair to say Peter's a curious character. He had got a job, I believe, with Public Health England or something. This is, I don't know if people hear from Public Health England, but this is the sort of position that, you know, it's a pretty safe job. You can get along in general for a long time without necessarily exposing yourself to the sort of risks that you clearly have. And Peter called me up and said, well, I'm going to give it up and I'm going to get out there because that's what's really needed. And I'm quite sure what I said, but the gist of it was, are you really sure about that? But he went ahead and did this, and I'm pleased to say he survived the experience, is here today, and I'm sure you'll be enlivened, and we're all very proud of you for doing that, Peter. So a final round of applause for Peter.